Welcome to True Health Tuesday. And the truth, except in New York Times, will set you free. I know there's a big thing called censorship, okay? And we're working up something to where we can talk about things that we can't talk about on this media and still have this media that we can talk with. Okay, so we're working up a couple of private sites that we can go to. We still have Dr. John Bergman, Extreme Health Academy. Boy, was this fun this week. Okay, how many sites were taken down? Lots, maybe 10 sites taken down. Yeah. Thank goodness for the Ministry of Truth. No, that was 1984. Okay, no, the Ministry of Monopoly. Okay, so let's look at cervical, spine, shoulder. Now, the cool thing with this is we're talking about anatomy and physiology because our population is sick and they're locked in homebound. Okay, so I'm going to show you solutions for headaches, carpal tunnel syndrome, shoulder and rotator cuff problems, the causes and solutions, but also stuff that's totally missed because we have a completely dysfunctional system. I mean, think of this. Let's say that you knew 93% of all headaches come from the neck. Okay, should you get the neck checked? Mm-hmm. No. We have a protocol. If you have a headache, you go to the ear, nose, and throat doctor or the primary care physician, and then he's going to send you to the neurologist, and the neurologist really isn't going to find any positive test on there because you'll have a negative blood analysis and a negative MRI because you're taking the MRI laying face up. So then they're just going to give drugs. What kind of drugs? Yes, restorative drugs. You take this drug and bam, your curve in the neck comes back, your discs regenerate, and you can run through a field of flowers with a dog running next to you. I saw the commercials. No, it's insane. Okay, so let's take this back and actually appreciate that human beings are smart and they give symptoms for a reason. Oh my God, that makes sense. So when we look at this, if you have a headache, the location of it's super important. Like if you have it over the eyes, it's more than likely going to be a sinus headache. Super easy way to diagnose that is to put a hand on the back, hand on the front, and approximate it, squeeze it together. And if that feels better, then that means the sinuses are trying to explode. So we know that there's a hypersensitization of the sinuses. What's the most common cause of that? You're looking at gut issues, leaky gut that creates inflammation. And also to look at all the allergies, because with the therapies that we're doing to our children that were healthy, with 72 doses of 17 different vaccines by the time they're 18, this creates an inflammatory response. And so much now that we actually have to have peanut-free days at ballparks. I'm sorry, that was last year. Now in 2020, we have people-free days at ballparks. So this way it cuts down on all that nasty allergy kind of thing. So let's look at what a normal neck is. A normal neck has a curve. Okay, and it's like that because it's like a cushion or a shock absorber. Because you got about a 12 to 15 pound head, so it has that riding ability. Now, the way that we take an x-ray, you're going to see this hard palate coming out. Now, that palate can move up to 20 degrees up or down without affecting the neck. Now, it's about 18 degrees there, and so we can still keep that as an accurate picture of the neck. But you got to show the hard palate in order to gauge whether that's appropriate. Now, how to take the measurements, the top of the neck should be over the bottom of the neck. That's called balance. Now, the trip is for every 1 inch that heads forward, the pressure on the disc doubles. So you've got about a 12 to 15 pound head. Okay, you put that forward an inch, you're looking at 24 to 30 pounds of pressure on there. Now, the problem with that is the body smart or stupid?
Smart. Very smart.
Smart. Okay, we got a couple of votes for smart. Okay, we had a doc one time when I said, is the body smart or stupid? And he said, excuse me. The body can just freak out and do things. No. if this is for all the doctors out there and all the human beings, okay, because doctors got the humanity changed out of them a lot. But, when we look at human beings, imagine if their body is intelligent. I know, mind blown. Oh, God. So that means it gives symptoms for a reason. So now for every 1 inch that heads forward, the pressure on the disc double. That means that these muscles back here are going to freak out to reposition that head. Okay, and now let's say that you have a headache, you have tight shoulders, and you go to the standard doctor that's not going to understand the appropriate protocols, which be, respect the human being, find the problem. Okay, that would be a nice protocol. But no, they give a drug to suppress the symptom or a muscle relaxant to relax those tight shoulders. Now, if the body is smart and it's trying to reposition this, you relax those shoulders, which way is the head going to go? Further forward, further increase in the pressure. Now, that's just a headache, but what other kind of things come out of there? Okay, I'm going to go into details on this, but there's a lot of stuff in the neck. Like when you look right at the base of the brain doesn't stop at the skull. There's an oblong section called the Medulla Oblongata that extends the top portion of the neck. Now, that's the cardiac and respiratory center. That's huge. And this is what happens. Like in the old days when people would be hung, that brainstem would have pressure there, so it would just shut off the cardiac and respiratory center like a light switch. Now, also, you've got a cerebral spinal fluid that flows in the brain. It's produced in the brain, and it gives nutrients to the brain and spinal cord. It's amazing. But with this head being forward, there's loss of that flow. And what we'll see, and this is 100% of people with Parkinson's diagnosis, we'll see a loss of curve in the neck. Loss of curve in forward head carriage, 100%. And you'll see this inside of the data that 9 out of 10 Parkinson's patients had an incident of trauma before the onset of the Parkinson's. And it could have been up to 10 years. So that means that this person, for 10 years, they had some kind of a trauma. And it wasn't either recognized, appreciated, or corrected. Okay, that's criminal. Okay, that's just flat out criminal. Because if you're a doctor and you're working on somebody and you actually trust that they're probably giving you the right symptoms, or if they're standing like this, or like this, or like this, or like this, that indicates that there is a problem. Particularly if you know that the body communicates to that brain. It communicates to that brain. That means every movement, every posture, everything communicates to the small brain and the cerebellum. And that cerebellum controls the frontal lobe. So does that mean body posture and position can alter the body's ability to communicate with itself? It's called proprioception. Absolutely. So that means abnormal position causes abnormal stimulation. Now, here's a patient before and after, okay? And we're looking at Parkinson's before and Parkinson's for 12 years. And you can see that there's a change. But also, have you seen the movements that come with Parkinson's? Yeah, because movement triggers dopamine. Movement triggers dopamine. So now a lot of the drugs that suppress those movements so the person can do some activities actually cause those type of movements. And you'll see almost every medication out there causes the symptom it's designed to treat. You take a drug for a headache, there's called a medication overuse headache. You take a muscle relaxant, the side effect of that is muscle spasms. I just read an article that blew my mind. Is suicide in psychiatry considered medical malpractice? Okay, now that's the title of the article. And I just, if you know that the selective serotonin reuptake inhibitor, the drugs that are very, very popular, they have a side effect of suicide and suicidal thoughts. So not really, because it says it on the box. Now, it's not just older people that have had trauma. These are kids. Now, when you have a kid in an American hospital, and we have one of the greatest infant mortality rates, I mean, El Salvador and Croatia are better than our infant processing rates. Why? Because we give the mom, certain vaccines that can cause an inflammatory response. We give them Pitocin or an epidural to deaden their awareness of their pelvic area. and a pitocin, which initiates uterine contractions, which shoves that kid's head up against the cervix, possibly if the cervix isn't dilated enough. And I know every nurse in here would say that a cervix has to be dilated to 10 for everyone. Have you seen large babies? Yes. Have you seen small babies? Yes. So it's not necessary that everybody dilates to one number, okay? It may require something else. But what we're looking at here, the picture up on the far left there shows pressure on the brainstem. Now, when you're looking at C1, and this is the top bone of the neck up here, when you're looking, it's a circle, okay? Can you see that? So if you're looking at the side of this, you don't see an opening. In order to see that, I would have to turn this at the side. Okay, does that make sense? So that means this person is looking straight, but their top bone in the neck is spun like this. And this top bone surrounds the brainstem. Do you think that you can have cardiac and respiratory centers with C1 not being correct? Duh. Okay, why isn't it checked? Because people aren't taught that. But when you look at this, these are all kids. Have you ever heard of an ear infection? You know, 93% of the time an ear infection is sterile. That's because you get a birth trauma, you get altered that nerve supply to the soft palate, and through that soft palate, and you can even experiment around with this. Do me a favor, swallow. Hear the crackling in your ears? Yeah, what you just did, you flex that soft palate, you got eustachian tubes that drain through it, that drain the middle ear. If you compromise the nerve supply to that soft palate, you're not getting that area to flex, so the ear fills up with fluid. An ignorant but well-meaning physician will look in there, see red bulging tympanic membrane, and go, oh, you got an ear infection. No, it's an ear effusion. Okay, there's no bacteria or virus or pathogen in there. It's just a mechanical distortion causing the middle ear to fill up. But what do? Do we send that kid to the chiropractor? Yeah, a lot of people do. Okay, but what about the ones that aren't educated? They'll give an antibiotic, which is a poisonous mold damaging the kid's flora, and he's going to be left with a chronic irritant like that. Now, if I stab you in the neck with my pen, yes, you would punch me. Okay, by rights. But what if you're stabbed in the neck for 6 months or a year or 5 years, and you're only 6 years old? Okay, you're not going to be consciously aware of that chronic negative stimulus or that chronic stress. Here's classic kid. I mean, this kid, his parents recognized that there was some neurologic damage, okay, from the vaccines. But when you look at this, his C1 is sideways. So he had physical stress, then he had chemical stress, okay, and this, he was under the autistic diagnosis. And, you know, of course, we hear this story the same way, in just, it's either 18 months, 2 years, just the date changes. Was on the standard vaccination schedule until 2 years of age when a negative reaction was observed after the MMR. Then he lost speech, had social withdrawal, loss of eye contact. Following the MMR, suspecting the vaccine-induced neurologic damage, he was put on a gluten-free, dairy-free diet. Okay. What's amazing is the parents actually recognize this. And I put this on how to recognize neurologic damage. They were sharp, man. The next day, okay, they went and did the research. They got him on a gluten-free, dairy-free diet, but this is him now. And that I cut his name out, but this is him holding the certificate to get into kindergarten. He no longer has a handler. He's in there full time. He's regular school. He no longer has the autistic label. Cool. Okay, now brachial plexus. This is a nerve plexus that comes out of the base of the neck. So now we know the top of the neck, that's where the brainstem is. The bottom of the neck, this is where a group of nerves that supply the entire shoulder area. Now, when we look at shoulder issues, your shoulder, this bone here is called the humerus. It's held in a socket by muscles called rotators. Now, the hip socket is in a full-on, full-born socket. The shoulder is really, really mobile, okay? And this thing has a little socket called a labrum. Now, these rotator cuff muscles, their job is to suck this into that socket. If any of them get weak, it doesn't fall out of the socket going down, it falls up. and we'll explain the mechanics behind that. But what happens a lot of times is people will say, you tore the supraspinatus. The reason the numbers are, or the muscles are named that way is because they're named for where they are or what they do. Little trick if you want to learn anatomy, it works, okay? Now, that big triangular bone there is called the scapula. It's something everybody has. And you have one bony attachment called the clavicle. You got 18 muscles that guide it up and down the body. That little bony line in the middle is called the spine of the scapula. And above it, we call that supraspinatus. And below that, we call it infraspinatus. Okay, so that's where you get the names of the muscles. The problem is, remember we're talking about forward head carriage? You have an outlet to the rib cage here, where the heart comes out, the pump comes out, and the veins drain in. So if you have the head being forward, this is called thoracic outlet syndrome. And typically, the most easily impinged structures are going to be to that top muscle, to the supraspinatus. So supraspinatus is the most injured in rotator cuff muscles. Can I tell you also that it's the most misdiagnosed? Okay, because what people will come in, they'll say, doc, tore my supraspinatus. It said it's completely gone. Now, how did the doctor get the information? He did an MRI. Now, position will distort the MRI. Also, inflammation will distort the MRI. So I'll say, wow, you tore it completely. Yeah, completely torn off. They said it was horrible. Might be even bone on bone. Because it's been like that for a long time. Okay, well, let's just check. Now, the supraspinatus moves the arm the first 15 degrees. After that, you got the big old huge muscle called the deltoid that moves at the rest. So if you see a completely torn supraspinatus, in order to move that, the guy's got to do a little hip swiggle to get it beyond 15 degrees, and then they lift it up. Okay, so what I'll do, I'll say, okay, hold your arm close to you, and I'll put my arm on top, and I'll say, okay, now push it apart. Okay, move it away from your body. And if they have strength there, I'll say, well, it's not torn. Okay, but you sure as heck better look at the neck. Because if you have forward head carriage degeneration, if that nerve supply to that rotator cuff is compromised, you're going to have compromised function. Does that make sense? Yes or yes? Absolutely. Why doctors aren't checking the first 15 degrees of motion, God knows. Okay, and that's not derogatory. He probably does. He knows everything. Boy, skated that one. Now the Catholics aren't going to be pissed with me. Okay. Actually, Sister Mary will still hit with the ruler. Okay, so when you look at this, the outlet to the thorax is hugely important. That for every one forward head carriage, the pressure on the discs double. So that has to be addressed. Now, how often is this missed? Almost every time. Almost every rotator cuff surgery journal. Okay, look at this. 1995, Journal of Orthopedic Sports and Physical Therapy, posture and shoulders overuse injuries in healthy individuals. Overuse injuries. You're going to hear this term over and over again. Does that mean you used it too much? That's what it implies, doesn't it? Except what you're going to find out is two people can be doing the same job. One person gets an overuse injury, the other person doesn't. So what's the deciding factor? It's not utilizing the body too much. It's utilizing that body with compromised nerve supply or blood supply to those structures. Does that make sense? Okay, good. And I love this. Forward head posture was significantly greater in the patient group rather than the healthy group. No other postural variables related. And they say, regarding the influence of posture to shoulder injury are inconclusive based on several confounding variables. No kidding. Are they looking for alterations of the structure? Remember, this thing has got one bony attachment, the clavicle, and 18 muscles that guide this up and down the rib cage. So does that mean that if you have a normal shaped spine where you got a 45-degree curve here in the neck, 33, and then you got curved down here, 36-degree lumbar curve, and it should be straight up and down, okay, but you have forward head carriage, lateral deviation, some kind of structure. Does that mean the scapula is going to have an altered function because it's going up a torqued rib cage? Of course. And we're just talking common sense. And you got to take a stress x-ray. That means you take it and then take another x-ray to see if it's moving. The Mayo Clinic, oh my gosh. Anyone like the picture of the Mayo? Okay. Yeah, if you're a police squad fan, you'll know what this is. A forward hunch posture can cause these tendons to become pinched. Eventually, this can lead to a tear and a more serious injury, pain, weakness to carry out daily activities. So they're saying forward head posture is, but they're not diagnosing it. And they're not showing you how to correct it. Because there's not a heck of a lot of people out there causing inflammation to restore that curve in the neck and changing proprioception so the curve comes back. They're just saying, yep, there's a problem. Okay, so what happens with this? If you have a weakening of that supraspinatus, if you have a weakening of any of the rotator cuff muscles, that shoulder does not fall out of the socket, it falls up. And what are the symptoms? Here to here, you can carry a purse, a weight, or anything beautifully. But if you go like this, bam, there's an issue. Okay, and that is an indicator that there is compression, or it's called impingement syndrome. And this is coming from forward head posture, loss of curve, and you can identify it really, really clearly. You go from here, you're strong, you go from like this, there's a pinch. That means that this humerus has been superiorly displaced or moved up. Why? Because you have a massive deltoid on top. And what that means is the socket that holds it, the labrum, okay, is going to be injured as well. Now, the labrum has a huge blood supply going on the outside. And in fact, you've got one of the tendons of the bicep that attaches to it. So this is really a good solid structure. Why do you think people continually, and I mean doctors continually, don't see this repaired on itself? Well, what's the number one thing that a doctor will do in crazy world if you have shoulder pain? Painkiller? Oh, okay, non-steroidal anti-inflammatory that destroys the building block of cartilage, proteoglycan production. You're right, that would be a shitty therapy.
Yeah.
You see how crazy it is? And since we know forward head posture is a contributing factor, we don't want to check it. Subacromial impingement syndrome, role of posture and muscle imbalances. The literature suggests that postural deviations associated with forward head posture follow distinct patterns involve increasing thoracic kyphosis and an and a downwardly rotated, anterior tilted, and protracted scapula. No kidding. What that means in English, you've got normal, okay? You've got trauma, loss of curve, forward head carriage. Now, the nerves that supply the heart come out of the top of the thoracic area. So if that is impinged, how many people have more than one heart? Yes, you're right, poets, okay? But I'm talking the one that beats, okay? So if you got nerve impingement on there, you're going to increase the kyphosis to take pressure off of it. Does that make sense? Because that's what they're saying there. When we look at this, 57% of large rotator cuff pairs fail. Why? What is the problem with the rotator cuff in the beginning? Forward head posture. How many professions restore the curve? One. They're called corrective chiropractors. Okay. Previous research has shown that between 20 to 90% of rotator cuff repairs re-tear. Why do you think so? You're right. They didn't fix the problem. It's not the rotator cuff that's the problem. That's the end result. And you know what we'll hear over and over again is, man, when I was shoveling, I just felt this pinch and the doctor said I tore my rotator cuff. Really, have you ever used a shovel before? Oh, yeah, man. I'm a landscaper. Okay, so you've done shoveling before. Yep. Okay, well, guess what? It wasn't the action. It was doing that action with forward head posture and compromised nerve supply. Does that make sense? And you know what these contractors are going to say? That does make sense. Okay? And I should not take my Tylenol. So this is what you do. This is the American Journal of Orthopedics and failed rotator cuff. Why? Cervical spine radiculopathy. That means you pinch a nerve here, it affects the area that it supplies. That means the nerves that supply the shoulder come out of the neck, the nerves that supply the elbow. So does that mean golfer's elbow, tennis elbow? Yeah. The nerves that supply the wrist, does that mean rotator or carpal tunnel syndrome? Are those all double crush injuries? Do they all begin with the cervical spine? Generally, yeah. I mean, you could have an injury like you're laying there in bed, nice and pleasant, sleeping, and your girlfriend comes over and beats your arm with a baseball bat. Okay, that could happen. Okay, it's rare. There's usually some other secondary problem. Suprascapular neuropathy, that is called a pinched nerve. Okay, intra-articular conditions, adhesive capsulitis, okay, all of these things, they're problems with that joint. But again, if that joint has healthy blood supply, healthy nerve supply, do you think that there's going to be any problem? No, the shoulders are designed to last an entire lifetime, and that could be 120 years. So if you're seeing these kind of pathologies, doesn't mean that there is some type of articulating challenge, that it's compromised blood supply or nerve supply. Yes or yes? It has to be. Now, when we look at this, arthroscopic repair for chronic massive rotator cuff, why the pooled re-tear rate was 79%. However, the re-tear rate is high. Existing research on massive rotator cuff repair is limited. Poor to fair quality studies. Yes, because they're not looking at the problem. Now, bursitis. What's a bursa? Okay, what's a bursa? You got to know that muscles attach to a tendon, and that tendon crosses joints and attaches to a bone. This is why I'm able to flex this, and this hand comes up like that. I mean, it's really, really cool. Okay, except if I keep doing that, okay, I'm creating friction. So the way the body is designed is around these tendons, because the tendons cross joints, there's a sac called a Bursa Sac. That Bursa Sac is filled with Bursa fluid. The Bursa fluid is the superfiltrate of blood. So now let's say that you know that the blood supply to that shoulder is coming out of this little tiny opening. If your head's forward, you're choking off the blood supply, right? Possibly the nerve supply. So does that mean you have healthy blood flow going to the arm or decreased blood flow? Oh my gosh, so what if you're using it? What if you're doing repetitive motion, okay, and you have compromised blood supply to that area? Do you think you're going to have healthy bursa fluid production or unhealthy bursa fluid? God, I can't stay like that. Okay, unhealthy. So the fluid won't be in that bursa, so it's going to start rubbing, creating friction, and then it's going to inflame. Okay, itis means inflammation, so we're talking bursitis. Go on, say it. Wow, I didn't know you were leading up to that. I always wondered what it was. And it's true. So now, what do we want to do? If you put a hot cloth on your arm, because let's look at the medical world, okay? Itis means inflammation. Inflammation, bad. Let's put ice on it. Bam. Okay, God, doc, that felt so good. Are you helping blood flow flowing to that by putting ice on it, or are you decreasing the blood flow to it? Right. So that's not smart. See, I didn't say stupid. Okay, that's not smart. Okay, but if we put heat on it, okay, now think of this. You put a hot cloth on your arm. What color's your arm? It's red because the brain senses that difference in temperature, so it increases the blood flow to that area, okay, to equalize the temperature. So why don't we do that? Okay, we put a hot cloth in the arm. This is what we do to everyone, because so many people are coming in here. You know, they worked on my shoulder, physical therapist, for years, and it feels good every time they do it. And I say, well, you know, I think they might be missing that old neck problem there. You mean I got a problem? Well, I don't know. It could be. I want to take an x-ray of it. And so sure enough, we put a hot cloth on it, and I'll say, good, now you're going to have better range of motion. They go, oh my God, it's amazing. I said, it's only a parlor trick, because that just shows that the forward head carriage has altered the blood supply to that area, so it altered the bursa fluid production and the synovial fluid production. Okay, so it's causing a problem. So once we restore that, you're going to be fine. In the meantime, just put a little hot pack on it. Bursitis, electron bursa. This is one of the toughest ones to fix, okay, because it hurts. Now, again, I'm going to walk you through logic. I know, it doesn't. Logic in medical doesn't work. Okay, so logic in chiropractic. Okay, so you have a Bursa Sac. Bursa Sac, this Bursa Sac fills up with fluid and drains, fills up with fluid and drain all day long every time you're moving it. Okay, now you have a Bursa Sac that's filling up with fluid, but it won't drain. okay? That's it swollen. So this is different than a compromised blood supply to that area. It's like it's not draining. So now if you understand the Bursa Sac, it has to have arteries going in and veins leading out. So it's almost like there was some type of damage that clogged these pores that they're not leaching out back into the system. Does that make sense? Because that's what you're looking at. So on something like this, if you put heat, it would just fill it up. It would be uncomfortable. So what you do is you create a back pressure. And that means that you're going to put like an ACE bandage or something to create that. But then what's this coming from? You're talking altered nerve supply. Because when you look at the forearm, you have muscles on this side called flexors, muscles on this side called extensors. And that muscles should be balanced almost. Should have a 5-to-4 strength ratio. That means the flexors are almost as strong as the extensors. And that's not what's happening nowadays. Because there's office workers, truck drivers, everything, they're using the flexors, but they're not making the fishing nets like we used to. Okay, so you have a muscle imbalance. So that's going to be a contributing factor. But once you restore the nerve supply, blood supply, and put an ACE bandage over it or some type of compression, and then use it through a general range of motion, you're going to blow out the valves. You're going to help that electron bursa start to have a normal fluid flow. Does that make sense? Because you've got cells called macrophages. These are big eaters. So if you have tissue damage in that, these macrophages are going to get in there, chew up the abnormally placed proteins. That's clogging the valves so that baby's filling up, but it's not draining. So this way it'll be allowed to drain just by creating that back pressure. Does that make sense? Calcific tendonitis. This is one of the things that drives me insane, which it's not, you're right, it's not a long drive. Okay, so calcific tendonitis. Okay, tendon inflamed. Okay, that means that a tendon has got a huge amount. Tendons, and we're looking at ligaments. Okay, ligaments are strong, flexible, but they're expensive. They take a huge amount of amino acids. Now, let's say that you have a joint that doesn't have good flexibility, that joint has altered nerve supply, blood supply, so you're compromising it. You're compromising the range of motion as well. This is why people move like this when they get older, because they were adapting to decreased nerve supply, decreased blood supply for years. So if you have altered decreased blood supply, nerve supply to years, the body isn't going to spend a lot of money or a lot of amino acids and metabolic forces to create these beautiful, strong, flexible, healthy ligaments. So the body starts to ossify them. It's going to turn that expensive ligament into calcific deposits. It's not calcium deposits. It's an ossification project or process that ligament, we're going to replace it with cheaper tissue. Okay, that's it. So when you see this, it's not the body is stupid laying down calcium because you're drinking too much milk or something, okay, which is psychotic, but I've heard that before. This has to do with long-term compromised blood supply and nerve supply. What if you restored blood supply and nerve supply? Would the body start to regenerate it back to normal? Yes. Yes, that's how it is. So when we're looking at this, you've got this beautiful, healthy ultimate shoulder joint. If you have loss of curve in the neck, you're compromising the blood supply and nerve supply, and you're going to see an alteration in function. Now, what you're seeing here on the left one, it's hard to see from where you guys are, but when this is put up on YouTube, and we're also too, next week we're going to try a live version on Facebook that they can actually see the slides. No, it wasn't me that came up with it. It was a computer guy that knows a lot about videos. So it might work next week. I don't know. Okay, so when you're looking at this, if you have altered range of motion, the body's going to distort the capsule that holds that shoulder joint or distort the bone. So when you look at deterioration of the joint, it's really not deterioration. It's adaptation from a chronic stressor or altered biomechanics. Here's a patient with a shoulder joint replacement. And now you can see long-term damage, long-term loss of curve in the neck, head being forward. But look at the thoracic area. Is that straight or is that bent at an angle? Remember, that shoulder's got 18 muscles that guide it up and down that rib cage area. But also, where that is, think of this. All the muscles that support the head stop in between the shoulders, a little bit higher than that. So does that mean that if your head's forward and off to the side, that you're going to start to develop some type of an adaptation to protect you? So this is hugely important. Does that mean that forward head carriage can negatively affect the nerves? Absolutely it can. And that's literally life or death. Here's a patient that just came in this week. She had shoulder surgery, say that 3 times really fast, scheduled in, I think it was like 2 weeks, okay? And I'm showing her. Now, if she had shoulder surgery and did not correct the thoracic area, did not correct the cervical spine, do you think it would work out really well? No, you got to fix the problem first. Now, this is one of the ways that you can fix it. Now, remember, first you got to restore the curve in the neck. Now, you've got the deltoid on top, that if you have a problem with the neck, that shoulder joint, that humerus will be distorting that labrum or that socket. So you got to get a weight to drop it down. And then this is a ligamentous exercise. You're just going to swing your arm butt to belly, but you have got to get that curve back first, okay? Or at least keep your head up. And you're going to start to feel a difference immediately. Why? Because this is going to start to rotate or change that rotation, that distortion of that labrum, so it rounds it. So you want your palms forward, weight, and you do not want to swing your arms a lot. You want to go very, very little. This is a ligamentous-based exercise. This guy is amazing. We're about an hour away from the Marine base down here, and there is a lot of Marines that have been hurt. This guy blown up a couple of times, and he was a bomb disposal guy. So, he was the one that people would call in. Bad shoulder, okay, but also bad neck. So you will not see a problem with the shoulder unless you have healthy blood supply and nerve supply. Okay, does that make sense? Mind-boggling. Now, this is insane, because think of this. Any type of damage to the shoulder does not fall out of the socket, it falls up. And so this type of motion hurts. Can you imagine having a shoulder that's not in the socket and then giving them an exercise to run it through the full range of motion? I know. I do. I cringe, because these people are coming in. Oh man, for a year, I've been crawling my hand up to stretch out my shoulder. And I'll look at it and I'll say, my gosh, you got a reverse curve in the neck. This isn't working. What the heck are you thinking about? This is actually a shoulder dislocation. I put this up for my youngest son, Danny. That's his shoulder, with the humerus out of the socket and then put back in the socket. Yes, he did say, thanks, Dad. Yeah, this is a super common injury in paintball. But again, what are we looking at? We're looking at a reverse curve to restored curve. And again, over and over. When you have a loss of curve in the neck, find somebody that can identify it, fix it, and show you that they've fixed it. Am I going too fast? Yeah, I know. Basic common sense. If you're going to buy a car, test drive it. Okay, the things not to do: no end range of motion, flexion and extension exercises with an unstable labrum. That's ridiculous, okay? Because if this thing is not in the socket and it's superior to place, do you want to work the muscles? No, you want to drop that thing back into place. You got to correct the forward head carriage. No ice on chronic shoulder injuries. Ice for an acute shoulder injury makes sense if you have torn blood vessels. And the prescription drugs, they don't help your body heal. Carpal tunnel. I used to do human dissection anatomy, and what I would do is I'd turn the wrist like this, okay, and I'd reflect this down, and you could literally stick a dime, okay, in that hole. It's about that size. Okay, now what happens is, think of this. Remember, you got muscles on this side called flexors, muscles on this side called extensors. If the muscles on the flexors are stronger than the extensors, it puts a flattening of that. It flattens it out. Now, in the medical world, see that little white tissue down there? That's called a flexor retinaculum. It actually looks like a wrist band, like you would have for tennis. In Crazy Stupid World, we're not going to look at the neck problem. We're not going to look at the muscle imbalance. we're going to take a knife and cut that flexor retinaculum to take the pressure off the nerve. Okay? And how many people come in and say, yeah, I had the carpal tunnel surgery on this, and I also had it on this. You know, it's coming back on this. The doctor doesn't know why. And I'll say, I want to take a picture of your neck. This is what you do to correct this. It's a number 32 rubber band. That's it. Oh, Sarah, can you grab the electric tape? It's on my desk. I forgot to get it. It's actually on between me and Dr. Drake's. So the number 32 rubber band goes around your hand, and you call it a flower bud. Then you go into a claw, but the fingers have to be curled. Flower bud to claw, flower bud to claw. Why? Because that's going to strengthen the extensors. Because normal ratio should be a 5-to-4 ratio. Okay, then, and you're going to do that to fatigue. But do you want to do this exercise like this? No. Let's restore the curve in the neck. Okay, now, let's say that you have a muscle imbalance, forward head carriage, horrible. How do you make a muscle imbalance worse? That's right, brace it. Okay, so let's do a brace that we can actually take the pressure off of that and utilize it. So now, when you're looking at a hand, you've got these bones here called the metacarpals. They stop right about here, and you can see that's where the wrist starts to bend. So you're going to put your thumb and pinky together, and you're creating a hole there. Then you take this, and the reason I like electric tape, for a couple of reasons. One, it's waterproof. It holds really well, does not stick to fur, which is really nice. Yeah, you think I'm kidding? How many people have duct taped your skin? It hurts when you take that off. Okay? So you put your thumb and pinky together, and you wrap it around the metacarpals. That's literally how you do it. And you don't want to do it too tight or too loose. There you go. Now, it's going to maintain the integrity of that tunnel, and I can use it. But you're going to use this only for the first week and a half in order to sleep. Because a lot of times this pain hurts so much, it wakes people up at night. It's horrible. Okay? And then to remove it, you just remove it. Do you want to reuse it? No. Comes in a roll. It's about 90 cents. Okay. Now, if that head's forward, all the muscles that support the head stop in between the shoulder blades. That's the sympathetic nerve supply to the heart. If you have a thoracic deviation, that's going to alter function. Can you understand now that if you have a problem in the neck, it's going to alter function everywhere? Okay, you're talking cardiac and respiratory center. You're talking shoulder, rotator cuff problems, golfer's elbow, tennis elbow. All of those are coming from muscle imbalances. Why? Because the heart has two nerve supplies. Sympathetic is from the top of the rib cage, parasympathetic's up here. So if you have an alteration in the head, those muscles that support the head stop right at the sympathetic nerve supply. You're going to have a deviation. Plus, you've got the nerve that supplies the diaphragm, the breathing muscle that comes out of there. So what's the mnemonic? C3, C4, C5 keeps you alive. That means the nerve that comes out of here supplies that breathing muscle. Does that mean, bam, head problem, forward head carriage? Oh, I got a problem with the breathing. I can't respirate. My diaphragm doesn't function correctly. What does that mean? Your system becomes acidic. You've got sensors located right here. You got a cardiac and respiratory center right there. And it's a pressure sensor and a chemo sensor. It senses carbon dioxide and it senses blood pressure. So if carbon dioxide levels go up, the heart rate increases. If carbon dioxide levels go down, the heart rate lowers. So in order to balance that pH, you've got these sensors in the neck. Yes, you're right. If you have a neck problem, they might not work well. I mean, we're talking basic. So if somebody has high blood pressure, why don't you look for the sympathetic dominant state or the problem that's causing the heart to work harder than it should? Chiropractic adjustments, it's amazing. And it has to do that if you adjust the neck, blood pressure starts to normalize. JMPT, 1988. Then if you look in 2007, the Journal of Human Hypertension, this was interesting because they're only adjusting C1, this bone, that's it. Okay, and then they follow them up. Why would just adjusting this bone? Yes, because it surrounds the cardiac and respiratory center, the medulla. So if there is pressure on it, Just like if I'm standing on your foot, your heart rate's going to go up. If you have pressure on this area, your heart rate and blood pressure will go up. You take the pressure off, they said it's amazing. It's more effective than 2 blood pressure drugs. I know. How about no, there's no negative effects and it doesn't increase your risk of stroke, because if you take 1 blood pressure drug, your risk of stroke goes up. Why? Because they work, they lower blood pressure, but your body is smarter than that. It needs pressure here because of dehydration or stress. You take it and to lower it down, the arteries want to constrict in order to raise it back up. That's like putting your thumb over a hose. It's mind-blowing. So people who need 3 medications or more are 248% higher risk of stroke. Again, it turns out that if you adjust the neck, that's the parasympathetic. If you adjust the rib cage area, that's where the sympathetic are. So it turns out that chiropractic adjustments can actually alter autonomic function. Respiratory center. I cannot stress this enough. So how many kids with asthma had a birth trauma at the start of this? It surrounds the brainstem. I mean, here we go. Reverse curve to normal, reverse curve to near normal. And how do you get this? I mean, we're talking the simplest thing ever. We used to do just like a dish towel around the neck to give a pivot point. Do you know why you're going to pull down and get your chin up? Because your mechanics are off. People will come in and say, gosh, doc, my neck hurt like the dickens, but it feels pretty good now. Buddy, your neck is not here, okay? It's supposed to isolate. You know, your shoulders are supposed to stay in one position while you move your head. Okay, so this way you isolate it and you look up, not back, you look up, okay? And this exercise, I do not give until I see what the neck looks like. Does that make sense? Or you can be 12 years old watching TV again, or have a desk. Put your elbows on the desk and lift your chin up. You don't want to lift it back, but lift it up. Now, if you've had surgery, if you've had multiple traumas, for goodness sake, get an x-ray. Find out what it looks like. If you want to get this adjusted, you're going to see a lot of chiropractors are going to turn the head and impulse. I don't like that. Plus, it's not effective in correcting the body. The way a corrective adjustment is done is you turn the head no more than 10 to 15 degrees, you contact like this and apply about 2 to 3 pounds of pressure using just this finger. Yes, this is the scary one, but I'm only using this one. Okay, so it makes it really easy. Use the middle one for changing lanes, waving hello, saying, you're number 1 too, buddy. Okay, there's a lot of reasons. Okay, now these are actual anti-inflammatories that make inflammation work. Okay, vegetable juice, turmeric, virtually any plant product. Why? Because inflammation is how the body heals. Hydration, your joints are hydraulic. That's right. You got the Bursa Sac filled up with fluid. You got the synovial membrane filled up with fluid. All of this stuff is hydraulic. So if you're dehydrated, this is why diabetics have joint issues, because their blood is thick. It can't get into those synovial membranes to get that synovial fluid production. Hydration. So what's the solution? And this should be the solution, or finding out one of the causative factors of blood pressure as well. Full set of x-rays, and this is cervical and thoracic and lumbar areas. Once the cervical curve is being restored, then you can start on the exercise. That makes sense. Doc, I'm like this with rotator cuff problems. Do you want to start working on this or restore the blood supply or nerve supply? If you're curious, just put a tourniquet on and go out and you can lift weights in our gym area there. Okay, that won't work. Proper supplements and nutrition eliminate the prescriptions that are toxic to tissue regeneration. Gee, that's a thought. So does that mean non-steroidal anti-inflammatories aren't an appropriate therapy? No, they're not. How long will it be till we're censored to say this? We're going to develop another pathway. Deep sleep, why? Because that's when your body regenerates. And once the labrum is stabilized, and then you can stretch, do whatever you want. So you've got to get the nerve supply and blood supply to those areas. If you're curious, the election that's coming up will eventually end. Okay? Life will eventually go on. Okay? Maybe riots and everything else, who knows? Okay, nobody knows what the restrictions are going to be. We can't all move to South Dakota or Texas. Medical mandates. Look at this group. They've got a lot of good data. Share the data, because only through education will we be able to change the world for the positive. We're not going to live with this supposedly new normal. These are the sites we have now. The drjohnbergman.com site, we're trying to put as many videos on there. Extreme Health Academy, you get that area for free. Okay, and we do a lot of different Q&As on there. The YouTube, God knows how long that's going to be on. Literally, he does. No. BitChute. Okay, we're also looking at library, and I'm open to any suggestions because the censorship is mind-blowing. We cannot talk about vitamin or let's make a difference in the world. Thank you very much.
Yeah.